Hi, my name is Grace, and I'm a nursing student at the College of St. Scholastica. This video is aimed at pregnant women or individuals thinking about pregnancy, as well as partners and family of people who are currently pregnant. I'm aiming this video at individuals who live in northern Minnesota, especially rural areas, as well as individuals maybe with less resources than others. And so I'm going to be sharing about some resources that are available to many people with free or reduced cost options. There is a really awesome comprehensive insurance program in the state of Minnesota called Minnesota Care that is often available to many people when private insurance is not. So I highly encourage people to look into that if that is something that you might be eligible for. Because of course primary care is really important when you are pregnant. It's really important for you to keep up regularly with an obstetrician. However, I understand this is not possible for everyone. So I want to share some options and some things that are important to do even when you can't access every piece of care that is available to other people. So one thing that's really important too in pregnancy is getting your vaccines. So before pregnancy, if you're thinking about becoming pregnant, it's a really great idea to make an appointment and catch up on any vaccines you might be behind on. It's also really great to make sure partners and family are vaccinated as well, because when you have that baby is really vulnerable to like influenza and COVID. And so it's really important that your baby is surrounded by people who are protected. When you are pregnant, it is safe to receive the COVID vaccine, the flu vaccine, and then the Tdap vaccine. And so there's actually a window that they'll want you to get a Tdap, which protects against whooping cough, which can be really devastating for babies. And then kind of as far as testing goes, before you get pregnant, it's a really good idea to know your HIV and hepatitis B status. They will test for those in pregnancy, and there's ways that they can protect your baby from those diseases, but it's really important to get tested for those before, because they can do some treatment before you get pregnant. And then one thing that's kind of unique to pregnancy is that when you are kind of close to delivery, they're going to test your vaginal bacteria for what's called Streptococcus B or Group B strep. And this is just a bacteria that some people have. It's like 1 in 4 women have this bacteria. It's just part of your natural flora, but it can be harmful to babies. So they will treat you for it in the hospital. And so they just want to make sure if you have it that they know about it. And then some things to avoid during pregnancy that can cause disease are unpasteurized cheeses. So these might be soft cheeses. So when you are interested in some of those cheeses, make sure they're pasteurized. Cold cut deli meats, those can cause bacteria, those can carry listeria as well as the cheese. And so it's important to make sure that all your meat is cooked to 165 degrees before you eat it, and it sits in your fridge for only about 2 weeks or less. So if you are really into deli meat, make sure you heat it up and make sure that it's fresh. And then the other thing to avoid is cat litter. So there's a parasite that can be found in cat litter sometimes called toxoplasmosis. And so if there's another person in your family who can clean your cat litter box for you, that's ideal. Otherwise, you can wear gloves and a mask and then immediately wash your hands after you're done. So that's some kind of overview information about things to keep in mind during pregnancy in terms of infectious disease. So making sure you're eating things that have been thoroughly cooked and kept safely in a refrigerator, not touching the cat box, getting tested for HIV and hepatitis B, as well as making sure you're up to date on your flu, COVID, and Tdap vaccines, as well as friends and family, and then testing for strep B or Group B strep. And then, so as far as community resources goes, in Duluth and Superior, there's an excellent local community clinic called Lake Superior Community Health Center. While they don't offer obstetrics, they do offer vaccines as well as testing, and so that's a great resource as a place to start. And then Planned Parenthood is always a great place too for obstetrics. They don't offer like full care, but they will counsel and help you find referrals. And they will help with vaccines and planning for pregnancy as well. And they offer free and reduced cost programs that they can help you apply for. So both of those are great community resources where you can find programs to help you before your pregnancy, maybe during your pregnancy, and maybe with friends and family nearby during your pregnancy. So those are some resources. Thank you for watching my video.